Thank you. Thank you all for being here today. I am cautiously optimistic after hearing the progress you all are making in your efforts to develop an effective and safe vaccine. And while the numbers of the vaccines that you anticipate having in the next year seem promising, I'm very concerned about the lack of a health equity plan in the distribution of those vaccines. The number one step is the science of developing an effective and safe vaccine. Number two step is to produce that vaccine. Number three is to distribute the vaccine. And then four is to administer the vaccine in the front lines. And we should be able to foresee what's coming and develop a distribution plan that's based on public health principles with the objectives to slow the trend of transmission and to save as many lives as possible. When we ask those questions, then we need to ask the questions, where is the highest risk and the highest rate of transmission of coronavirus, and which communities and demographics are dying at a higher disproportionate rate of coronavirus? And it is not too difficult to find the answers to those questions. We know that seniors in nursing homes are at highest risk of dying, those with underlying conditions. We know that African Americans, Latinos, Native Americans are at the highest risk of getting infected and also dying from coronavirus. We need public health principles based on public health equity, not politics, not for profit, going to those who are the highest bidders, or objectives that favor the powerful, the prosperous, or the healthy, or large corporations who can afford and offer the highest bidding amount in order to keep their healthy workers safe to affect their bottom line and their profit. We cannot repeat what has happened already in the distribution of testing, in the outreach, and in the treatments of the coronavirus. I was just called by a previous employee yesterday who told me, or texted, who told me that his sister, who works in the front lines as a nurse in COVID-19 units, who was recently exposed, couldn't get testing herself. It wasn't offered. It wasn't offered in the hospitals. She had to go to an urgent care and pay for it for herself. It was difficult to get testing. Yet he has a cousin who's in training for the Washington Nats, the professional baseball team, and they get tested every 2 days. So my office is hearing the same thing from nurses across my district. This is unconscionable, and we cannot repeat this mistake with the distribution of vaccine. So having millions of vaccines is a good first step. We also need to be planning now how we get the vaccines into the hands of the people that need this most. And I don't want to look back and then have health equity be an afterthought. It has to be prioritized. So I want to ask Dr. Gerberding from Merck, what is your company doing to ensure that the distribution of these vaccines are getting to the populations that need them the most, with the highest transmission and the highest death rate from COVID-19?
I think the best way to answer your question is to think through what already works and doesn't work in this regard. It is the CDC's responsibility, the ACIP, that makes decisions about allocation. But in this very special case, I have personally, and I think many of us have called for the National Academy of Medicine to create a mechanism to look at health equity and make sure that the allocation is fair.
Thank you. Thank you very much. You know, I've heard a lot of, well, that's the government. That's the government. But not all of you are going to give 100% of your vaccines to the government. There's going to be a percentage that you will hold back for the private market as well. And that market should also follow a public health principle so that we can save as many lives and we can stop the surge in order to improve the public health. Dr. Young from Pfizer, can you answer that question for me, please?
Very important question, and I want to, support what my colleague, Dr. Gerberding, has just said. We believe that actually the CDC has laid out very clear criteria for a pandemic situation as to which patients should actually be prioritized. We look forward to working with the federal government and its agencies in order to ensure that distribution of our vaccine, if successful, It's the patients
I'm
who
going
need
to
it
ask
most.
every single one of you if you can please mail my office and this committee your distribution priorities, not only that go towards the government, but also that you have within your own private market sales and distribution, and what your objectives are during this pandemic. Can you do that, please?
Yes, we will.
Yes.
Thank you. Dr. Pangalos, Dr. Hogue, and Dr. Gerberding, can you do that?
Yes.
Okay, I'll take that as a yes from all of you, and I'll follow up with you as well. And I believe I heard from Johnson & Johnson, Dr. Dugoy as well. Thank you.